Hello! Thanks for viewing the online version of Deworming for the 21st Century. Are you doing it wrong? I'm Dr. Lisa Kivett, owner of Foundation Equine, located in Southern Pines, North Carolina. In this presentation, you'll learn about common misconceptions in equine parasite control and what you should really be doing for your horses. I want you to imagine that every other month, when you show up for work on the first Monday of the month, your boss hands you a round of antibiotics to take. Just in case someone here is getting sick, she says. This month it's doxycycline. Next month we'll all take cephalexin. Would you do that? Would it seem incredibly weird? If this scenario seems so absurd, why are we doing this with our horses in the form of rotation deworming? So most of you already know what rotation deworming is, but just to review, rotation deworming is the concept of administering a different dewormer every few weeks or months to every horse on a property. Here's an example of a rotation schedule found online. It's worth pointing out that when you find these schedules, they're not identical. There's absolutely no logic to the timing of the particular drugs administered. Note up here at the top it says, veterinarians recommend deworming every 2 months. This is absolutely untrue. The American Association of Equine Practitioners, which is the guiding organization for equine veterinarians, has recently published a lengthy set of guidelines for deworming horses, and it absolutely does not encourage the practice of rotation. In fact, I don't personally know a single veterinarian who still recommends this practice. Rotation deworming was developed in the 1970s, and it seemed like a really good idea at the time. However, like many things, it didn't stand the test of time, and we later realized the error of our ways. So why doesn't rotation deworming work? For one thing, rotation does not take into account the different durations of action of each different drug, the different parasites that might affect horses on a particular farm or in a particular geographic area, and the difference in parasite transmission during different seasons. But before we can fully understand where we've been and where we're going with deworming schedules for horses, we have to understand what we're targeting, the different types of parasites that affect our horses. Large strongyles are 1 to 2 inch long, red-colored parasites. They are sometimes referred to as bloodworms. While there's no need to get overly complex on the life cycle of these parasites, there's one important thing you need to know about large strongyles. After the infected larvae are ingested by the horse, they complete their life cycle by leaving the intestine and crawling around through the horse's body. They particularly like to crawl through the walls of large blood vessels, which is where they actually cause the most problems. The most severe consequence of long-standing infection with large strongyles is damage from parasite migration through the major arteries that feed the intestines. This damage stops the flow of blood to the intestines and can cause severe colic. It was these nasty creatures that were the original impetus for the creation of rotation deworming. Over 40 years ago, when rotation was created, these were the most common and most important of the equine parasites. Rotation deworming targeted Strongylus vulgaris, a large strongyle, killing these parasites before they could mature and lay their eggs. Since it took about 2 months for the eggs to reappear after treatment, the every 2-month schedule prevented the eggs from being shed into the pastures. As it turns out, it worked. Large strongyles were weak and they didn't develop resistance to the dewormers, and they're now very rare in our horses. I've actually seen only 1 case of colic associated with these parasites. It was in a horse that was not well cared for, and it was during my residency at Auburn University. We encouraged all the students to come and take a look at the postmortem exam, since it would probably be a very long time before they saw something like this again. Since large strongyles are now very rare, what's the major intestinal parasite of horses? That would be small strongyles. Despite the similarity of the name, these are actually a completely separate species, with the scientific name Cyastomins. Small strongyles are really small. Their infective stage is less than 1 millimeter in length. The picture on the right is actually of small strongyles within a single drop of water. The life cycle of small strongyles is somewhat similar to that of large strongyles, in that the horses pick up the infective larva from the pasture and the parasites go on to develop further inside the horse. There's one important difference though. The small strongyle larvae, instead of crawling around the horse's intestines and through the vessels and organs, crawl into the lining of the intestines, and they can encysted or hibernate there. These are pictures of those encysted small strongyle larvae. They're basically hanging out there just under the lining of the intestine, waiting to develop further and emerge. Once they're there, the parasites can immediately proceed through the rest of the life cycle, or they might stay there hibernating for up to 2 years. It's thought that these parasites developed this evolutionary advantage over time as a way to sustain their population inside of horses when the environment was harsh. It's this feature also that may help them avoid many of our common dewormers. Small strongyles rarely cause any disease in horses, and very high levels of infestation are required before any problems are noted. The major clinical disease associated with small strongyles is the emergence of encysted larvae. The disease requires large numbers of these larvae to be hibernating or encysted in the intestine and laying dormant for a long period of time, before all of them then simultaneously emerge at one time. This causes inflammation in the colon and causes the horse to develop loose manure. So how do we diagnose small strongyle infection in horses? While we can't determine how many encysted small strongyles are present, we can evaluate the manure of horses to determine the presence of mature egg-laying adult worms. The number of strongyle eggs present in the manure is a reflection of the number of adult worms living within that horse. Ascarids are another important parasite of horses. These worms are spaghetti-sized or larger yellow-tan parasites, also referred to as roundworms. Ascarids primarily affect young horses, less than a year of age. Adult horses develop immunity to these worms after they're about 1.5 to 2 years old. However, we do occasionally see ascarid eggs on fecal egg counts of adult horses. This may be due to the fact that ascarid eggs can stay infective in the environment for years. It also may be due to ascarid's development of high levels of resistance to common dewormers, or it may be due to lack of immunity in some adult horses. Either way, it would be extremely unusual to see any clinical disease caused by ascarids in adult horses. The important thing about the ascarid life cycle is that these worms, after being swallowed, leave the intestine, crawl through the liver, go to the lungs, and then get coughed up into the mouth and swallowed, where they return to the intestines to live for a while. This can actually cause coughing in affected young horses. The most severe disease associated with ascarid infection in foals is formation of an Aspirin Impaction. If foals are exposed to high levels of ascarids and are not properly dewormed, they can develop such a heavy parasite burden that a worm impaction actually forms, and this can require surgical intervention. Diagnosis of ascarid infection is also made using a fecal egg count. The ascarid eggs are larger and more round in shape than the eggs of strongyles. Tapeworms are another important parasite of adult horses. You may have seen tapeworms in the fecal material of dogs, which resemble grains of rice. Equine tapeworms, however, are proportionately larger, and they can be up to several inches in length. Tapeworms are the only equine parasite that requires an organism other than the horse to complete its life cycle. Tapeworm eggs develop into infective larvae inside of little pasture mites, which are microscopic and ubiquitous in our area. The important thing about this parasite is that the mature worms attach themselves to the ileocecal junction, the place where the small intestine attaches to the cecum. The cecum is like an expanded appendix. It's a large blind sac on the horse's right side where fermentation of feed takes place. With heavy tapeworm infection, these worms can cause disturbances in the movement of feed and cause subsequent colic. Diagnosis of tapeworm infection actually can't be made on a fecal egg count examination. The eggs of these parasites rarely show up under the microscope. Evaluation of centrifuge manure samples as well as blood tests have been developed but are not in widespread use. Pinworms are actually the culprit for one of the most common parasite emergency calls that I get. Doc, oh my God, I just found a worm in my horse's poop. My response is usually, does it look like a bean sprout? Yep, it's a pinworm. Don't panic, it's no big deal. The pinworm's life cycle is really straightforward. Pinworm larvae don't embed in the intestine and they don't migrate through the body. They just pass through the intestine. However, the female pinworms do lay their eggs on the anus of the horse in a white sticky paste, which is very itchy for the horse. Interestingly, pinworm infections in adult horses were once very rare. They're now much more common due to high levels of resistance to common dewormers. This itching and tail rubbing is the only clinical disease caused by pinworms, but it can certainly become a problem when horses rub their tails or cause injury to their rear ends while they're scratching. Diagnosis of pinworm infection can be difficult. Like tapeworms, the eggs aren't readily visible under a microscope when performing a fecal egg count. They are visible under the microscope if you scrape the eggs from the anus onto a slide with a tongue depressor, or if you press Scotch tape to the anus to pick up the eggs. However, the most common way pinworm infection is diagnosed is by observation of the white paste on the horse's anus in combination with the horse rubbing his tail. Bots are actually not a worm, but the larva of a fly. The scientific name for bots is Gasterophilus species. The bot life cycle is very strange. The mature flies lay these little yellow eggs on the legs and body of the horse, which the horse licks at or chews. The eggs then get into the mouth and hatch, and the larvae crawl around the mouth and get swallowed. Once they're swallowed and in the stomach, the bots attach to the stomach lining and they grow there for 8 to 10 months. These are pictures from the various stages of the life cycle of the bot. Here's a mature fly, and here it is laying eggs on the legs of the horses, which we've all seen, those little yellow eggs that we try to scrape off before the horse actually bites them or licks them and ingests them. Then those little eggs hatch into larvae, and they make little nests in the mouth of the horse, which you can actually see here on this picture. Once the larvae hatch from the nests and crawl around the mouth and get swallowed, they can actually set up infection in the stomach and attach to the lining. And here are 2 mature bots attached to the stomach lining of a horse. Here's a video of some of those bot larvae crawling out from one of those nests between the teeth. We don't actually worry all that much about diagnosing bot infections in horses. However, when we scope a horse's stomach, we may sometimes find a few mature adult bots hanging out there attached to the lining. So now that we've discussed all the common parasites of horses, let's discuss the common dewormers used in horses. There are 3 major classes of dewormers: the benzimidazoles, which all end in azole, pyrantel, which is basically just strongid, and the avermectins, which are represented by ivermectin and moxidectin. These are the egg reappearance periods for the 4 most commonly used dewormers. This is the amount of time that passes following administration of a dewormer before the horse becomes reinfested with adult worms and begins shedding worm eggs through the manure again. It's important to note the differences between the dewormers, as well as the fact that egg reappearance periods have shortened since each drug was introduced. Do you know what caused the shortening of the reappearance periods? If you recognize that this indicates the development of resistance, congratulations, you're 1 step ahead. Equine parasites have developed dewormer resistance through natural selection. Just like bacteria develop antibiotic resistance, or animals develop advantageous characteristics over time. Traits that benefit the organism will persist, since the strongest organisms will go on to reproduce. So we've spent over 40 years constantly exposing equine parasites to common dewormers, which ultimately just selected for the strongest worms, the ones who harbored the genes that allowed them to withstand the treatment. Those strong worms went on to reproduce and create more strong worms. We can identify dewormer-resistant parasites by observing fecal egg counts before and after administration of a dewormer. When parasites first begin developing resistance, you can observe the egg reappearance period shortening. The eggs come back weeks sooner than they once did. Later, as resistance becomes more widespread, the dewormer will fail to significantly reduce the worm burden and egg shedding altogether. While we were inadvertently selecting for the most resistant parasites, we were also inadvertently potentially selecting for horses who are more susceptible to parasites. We've selectively bred horses for hundreds of years for color, height, appearance, athletic function, but certainly never gave any thought to whether or not they were parasite resistant. Horses were once acutely adapted to their environment. Survival of the fittest over generations produced hardy horses that would be able to withstand parasitism. As we've bred them and pampered them, they've certainly lost some adaptive characteristics, and possibly a degree of parasite adaptation. Each individual horse has its own level of susceptibility to infection with parasites. If we look at a group of horses, we'll generally find that it follows the 80-20 rule, meaning 20% of the horses will shed 80% of the parasite eggs in the environment. For simplicity, we commonly separate horses into 3 groups based on their particular level of egg shedding. Low contaminators consistently shed low numbers of eggs, and high contaminators consistently shed large volumes of parasite eggs. While we can control egg shedding through chemical and environmental means, this is an inherent part of the horse's makeup. A low contaminator will always be a low contaminator, and so on. So can we tell which horses are high contaminators just by looking at them? Which horse here would you think is the high shedder? You actually definitely can't tell by appearances. In my experience, the absolute highest shedders are usually quite fat. It does seem that a horse's susceptibility to parasitism and subsequent egg shedding are a genetic trait. This may vary between breeds and may be passed down from stallion or mare to foal. Returning to the parasite side of the equation, let's look at the resistance patterns of each individual group of parasites. Like I mentioned before, large strongyles did not develop resistance to dewormers and thus are no longer a common problem. Small strongyles, however, have developed significant resistance to many dewormers. These numbers represent farms studied in Georgia in 2001. At that time, almost all farms had small strongyles that were unaffected by administration of fenbendazole, which is Panacure's safeguard. About 30% of the farms had worms that were unaffected by Strongid. Keeping in mind that these studies were performed 13 years ago, it's reasonable to assume that the situation has only gotten worse. In addition, signs of ivermectin resistance are becoming increasingly prevalent. Where the egg reappearance period was once 10 weeks, I now sometimes see significantly high fecal egg counts in horses that were dewormed with ivermectin only 6 weeks ago. Though resistance to moxidectin or Quest hasn't yet been documented, if we're not very careful and very judicious with its use, it too will soon begin to fail. Since no new dewormers are on the horizon, you can see why it's so incredibly important to not overuse the few dewormers that still work. If we're not careful, we could end up with no effective dewormers whatsoever. So based on the information you've just heard, I'd say that you might as well toss your Panacure, your Safeguard, and possibly your Strongid into the trash can at this point. Ascarids have developed resistance to almost all available dewormers. They're essentially the cockroaches of equine parasites. Nothing is 100% effective against them. Resistance patterns do vary from farm to farm, but overall, resistance to ivermectin and moxidectin is widespread. There's also documented resistance to Strongid and fenbendazole. That's essentially every dewormer, making ascarids a real problem to control. So as far as pinworms go, it's important to note that nothing is 100% effective against these worms, and the situation may be different on every farm. The literature will tell you that ivermectin is 80% effective against pinworms, but in my experience, if a horse has an active pinworm infection, ivermectin will usually fail to eradicate them. Panacure is almost always ineffective, and Strongid is highly variable. So at this point, the best options for treating a pinworm infection are moxidectin, or Quest, and oxybendazole. Since I like to be cautious with the use of Quest, I'll typically treat pinworms with oxybendazole. Tapeworms, by nature, are not killed by ivermectin or moxidectin. A double dose of Strongid is typically thought of as being effective against tapeworms, and any dewormer including praziquantel will be effective against these worms. Dewormers that include praziquantel are usually Zimectrin Gold and Equimax. So let's review what is effective against each of the equine parasites. For small strongyles, ivermectin and moxidectin are still effective, though ivermectin's efficacy is becoming reduced. For ascarids, the situation varies from farm to farm, but Strongid, oxybendazole, and fenbendazole, though often requiring a double dose or power pack dose, may be effective. For tapeworms, any product containing praziquantel, which is Zimectrin Gold or Equimax, is going to be effective, as well as possibly a double dose of Strongid. And for pinworms, moxidectin or Quest may be effective, and oxybendazole may also work. For bots, ivermectin and moxidectin will be just fine. With all the issues of resistance, and with populations of parasites on each farm being different, how do we know if the dewormer we selected works? We can evaluate this using a fecal egg count reduction test. If we perform a fecal egg count on the horses, identify parasites, and deworm with a presumably effective drug, we can then perform a second fecal egg count in 10 days to determine if the fecal egg count has dropped by at least 90%. This second 10-day sample does not have to be performed on all the horses, just a few, since we're evaluating the susceptibility of the parasites to the dewormer, not the horses. If the fecal egg count is not reduced by 90% at 10 days, we know that the particular population of parasites is totally resistant to that dewormer. So remember the phenomenon of the encysted small strongyles, those larvae that can sometimes lay dormant, hibernating in the walls of the intestine? While they're there, they're only susceptible to two products, Quest and the Panacure Power Pack. Of the two, Quest is the less expensive alternative and may be a better bet than the Power Pack, since it seems that there may be some resistance developing even to the very high dose of fenbendazole contained in a Power Pack. That being said, because it's important to not overuse Quest, I typically recommend Quest only for horses with very high fecal egg counts, or horses with diarrhea that may be due to the encysted small strongyles. There's probably no reason that a horse needs to receive Quest any more frequently than once a year, and I usually think that every other year is more than adequate to prevent accumulation of the encysted small strongyles. I'm also going to take a moment to make a point about the Panacure Power Pack. I often see horses that have been dewormed with this product, which is a 5-day double dose of fenbendazole, as the only means of parasite control. Horse owners often perceive this to be the most effective treatment against parasites, possibly because it's so expensive, it must work, right? Well, not exactly. While I mentioned that the Power Pack may be able to kill encysted small strongyles, it very often has absolutely no effect on fecal egg counts, meaning it's not an effective dewormer against the active, egg-producing adult worms inside the horse's intestine. If you want to use a Panacure Power Pack on your horse yearly or every other year to address any encysted small strongyles, this cannot be the only dewormer that you use. The true goal of parasite control in horses is to limit the parasite infections so the animals remain healthy and clinical illness does not develop. The goal is not to eradicate all parasites from a particular individual or farm. Not only is eradication impossible to achieve, but the inevitable result is just accelerating the development of parasite drug resistance. Additionally, low levels of parasitism are not harmful to horses, and attempts to keep a horse completely parasite-free may have other adverse health effects. I now have to quickly explain a relatively complicated concept called refugia. Refugia is the word for the population of parasites that aren't exposed to a dewormer whenever it's given to a particular horse or group of horses. These parasites, the ones that don't encounter the chemical, are the ones that aren't freely living in the horse's intestine. These are the parasites that are living on the pasture, the parasites that are encysted or hibernating in the colon wall, and the parasites that are living in the horses that were not treated with the dewormer. These parasites are important because they serve as our constant supply of weak parasites, the ones who aren't developing resistance. When you deworm a group of horses, the parasites that survive the treatment will be the ones that were resistant to the drug. If those parasites breed and begin to outnumber the weak ones, that's when we get into trouble. So one of our goals is to allow the refugia, or the weak, non-resistant parasites, to survive. To accomplish our goal, which is to limit parasite infection while decreasing the chances for development of resistance, we need to be deworming horses based on fecal egg counts. Fecal egg counts are performed by mixing a specific quantity of a horse's manure with a fecal float solution and counting the parasite eggs seen under a microscope within a specialized chamber called a McMaster's chamber. The McMaster's fecal egg count technique gives us the specific number of eggs per gram, which is the basis for determining whether a horse needs to be dewormed. A simple fecal float, similar to those performed for small animals, is inappropriate, since no determination can be made from simply calling a sample positive or negative. It's extremely important that results are given in eggs per gram. This flowchart shows the basic decision-making process used for deworming based on fecal egg counts. This chart is also available on our website for download. It's important to note that the cutoff value for deworming, stated here as 350 eggs per gram, may vary based on individual horses and individual farms. It's important to work with your veterinarian to determine the most appropriate course of action for your particular situation. There are some limitations to the fecal egg count. It cannot detect parasites that are migrating through the body or small strongyles that are encysted in the colon wall. These parasites are not actively producing eggs in the horse's intestinal tract, so they aren't detected by counting parasite eggs in the horse's manure. The other major limitation of the fecal egg count is that it can't detect the eggs of pinworms, tapeworms, or bots. Since we can't easily diagnose tapeworms or bots on a fecal egg count, we do recommend a once-yearly deworming to take care of these parasites. Some veterinarians recommend twice-yearly deworming, but since I'm concerned about development of resistance, I tend to advocate for a less-is-more approach when it comes to deworming. We often recommend timing this once-yearly deworming during the late winter or early spring for a couple reasons. First, the bot flies will have stopped laying their eggs, so all the bots in the horse's body will be targeted by this once-yearly deworming. Second, we can eradicate the tapeworms before the New Year's grazing season starts. So as far as timing goes, we definitely don't want to deworm when there are no parasites freely living on the pasture. This has to do with our concept of refugia. If we deworm when there are no parasites outside of the horse, when it's too hot for them to survive in the southern states or too cold for them to survive in the northern states, then we're going to have little or no refugia, no parasites that escape the treatment, no source of weak, unexposed parasites. All the ones that survive the deworming will be the ones who were resistant to that dewormer. Here in North Carolina, the hot summers are the time in which parasites are not transmitted. It's too hot for them to survive on the pasture. So deworming in the summer is out if we want to allow for survival of our refugia. Another important recommendation when discussing once-yearly deworming of horses for bots and tapes is to never deworm all horses at the same time. Again, this has to do with refugia. If you deworm all the horses at the same time, the only parasites that will survive are the ones that carry the genes for resistance. If you deworm half the horses at one time, wait a few weeks, and deworm the other half, the untreated horses at each time period will serve as a source of good, weak, unexposed parasites. Just remember, deworming all the horses at the same time breeds resistance. I recommend waiting 8 weeks between deworming groups of horses, but that timing is just personal opinion. One exception to these rules is when a horse develops clinical disease from parasitism. This can be weight loss or unthriftiness in the poorly cared for horse, or it can be the development of diarrhea associated with massive reemergence of encysted small strongyles. I most commonly see this diarrhea in a horse that looks otherwise very happy and healthy and has a history of a fecal egg count greater than 1,000 eggs per gram within the last 12 months. Deworming with Quest does usually stop the diarrhea within a week or two. A fecal egg count reduction test is a tool that can be used to determine whether dewormer resistance is present on a farm. To determine if the parasites are totally resistant, a fecal egg count is performed 10 days after deworming with a particular product. If the egg count is not at least 90 to 95% decreased from the sample evaluated prior to deworming, then you know that that dewormer failed completely. Now, prior to complete failure of a dewormer, you will see eggs returning within a shorter and shorter period of time after administering that product. For example, if eggs begin to return within 6 weeks of administration of ivermectin, you can be sure that resistance is beginning to develop, since the eggs should not be returning for at least 8 weeks. I typically perform a simple fecal egg count reduction test, or the sample at 10 days after deworming, every couple of years on a farm. Not every animal will need to be tested, since resistance is a feature of the parasite population, not the individual animal. I'll try to perform weekly testing on farms in which I find high numbers of parasites within only a few weeks of deworming. In addition to strategic deworming, there are some other ways to control parasites on your farm. The most important of these is manure management. When possible, paddocks or pastures should have all manure removed weekly. This can be accomplished by picking or with fancy pasture vacuums that you can order on the internet. Once you've removed the manure, it should be composted properly before being spread back on the pastures. The high temperatures achieved during good composting will kill all the parasite eggs. Remember, composting and simply creating manure piles are not the same thing. Another strategy for pasture management is the pasture rotation strategy. Rotating pastures with other species is a great idea since the parasites are species specific. Rotating horses with sheep, goats, cows, or camelids will disrupt parasite transmission cycles. Now, simply resting the pastures for a period of weeks or months will not have the same effect. So I'll be the first to admit that picking pastures and composting or buying cattle is not going to be practical for everyone. So if you can't do these things, just make sure that there's plenty of room for each horse. Overstocking or having too many horses on a pasture will force the horses to graze closer to manure piles, leading to increased parasite transmission. I'm often asked what to do with new horses entering a farm. Each new horse onto a farm should have a fecal egg count performed prior to arrival. It's also a good idea to have them dewormed with Quest as well, so they don't shed any resistant parasites onto your now well-managed pasture refugia. I'm often asked about various herbal remedies, including diatomaceous earth or DE. Unfortunately, these products don't work. I've checked fecal egg counts on many horses that have been administered these products, and they almost always have high fecal egg counts. It's important to remember that supplements are not regulated in any way by the FDA or any other entity. These products could easily contain nothing but dirt and could make claims to cure or prevent any condition or disease. Another product I'm often asked about is Strongyl C, the daily dewormer. I'm not a huge fan of this technique since the amount spent on daily dewormer is usually more than you'd spend on 2 to 3 times yearly fecal egg counts. Horses on Strongyl C do still need a yearly ivermectin and praziquantel dewormer to take care of bots and tapes. Since many horses only need once yearly deworming anyway, the Strongyl C is really probably not necessary. This product also isn't a good treatment for a horse that already has parasites, but it might be useful in some cases. For example, on a farm in which 1 or 2 horses are persistent high shedders, it might be possible to use Strongyl C to control shedding in those animals, allowing for less frequent deworming of pasture mates. Now, all this being said, it's important to remember that using these products will likely slowly lead to the development of resistance. I want to very briefly mention a few other equine parasites. Mostly I just want to convey what a wide world of parasites lives all around us in our horses. Of the parasites listed here, only Habronema and Dictyocollis are seen with any frequency in our area. Habronema and Droscia species of parasites are the parasites that cause summer sores. Summer sores are created when flies deposit the larvae of these worms onto a wound, which may be something as small as a scratch. The larvae within the skin then cause severe inflammation and an open sore that won't heal. Historically, a dose of oral ivermectin would eliminate these larvae and allow the sore to heal, but in recent years it appears that oral ivermectin is no longer effective against these parasites. Summer sores now often require much more aggressive treatment with topical ivermectin-based ointments or injection with ivermectin and steroids. Dictyocollis arnfieldi is the unwieldy scientific name for the donkey lungworm. Donkeys infected with this parasite rarely show clinical signs, but can spread the parasite to horses. Infected horses often have a cough due to bronchitis associated with parasites in the lungs. A horse with a cough, who lives with a donkey, may be suffering from infection with this worm. Ivermectin administration usually does resolve the issue. Onchocerca is a parasite that is rarely transmitted by biting flies. Clinical signs are the same as for sweet itch or insect hypersensitivity. Most horses with compatible clinical signs will respond well to controlling flies with sprays, fans, and fly sheets. If Onchocerca infection is identified, resolution is usually obtained with ivermectin administration. Halocephalobolus and Paralephostrongylis are two more extremely rare parasites that affect horses. Paralephostrongylis affects horses less than 3 years of age. This parasite infects the spinal column of the neck, resulting in a very fast onset of torticollis, or a crook in the neck. Treatment is unsuccessful, and these changes are permanent. Now, Halocephalobolus deletrix, my favorite parasite name of all time, is another very rare infector of horses. It can infect the brain or the neural tissue, causing neurologic signs, or can infect other internal organs. I've only ever seen one case of infection with each of these parasites, so again, they're extremely rare. All right, so it's time to wrap this up with a set of do's and don'ts for deworming your horses. Please do deworm based on fecal egg counts. Consider performing a fecal egg count reduction test occasionally on a few horses on the farm to determine whether resistance is occurring on your farm. Do remove manure from pastures if you can. And if a horse does not require deworming for 12 consecutive months, administer a Zimectrin Gold or Equimax at some point during the year, preferably in the spring or fall when the parasites are alive on the pastures. Also, please get your veterinarian involved in your farm's deworming program. As you've seen, there's tons of changing information when it comes to resistance patterns of particular parasites, and your vet can help you determine what works in your area. Please don't rotate dewormers. This is an outdated and dangerous concept. Don't deworm all horses at the same time, since that can lead to resistance. And don't dose and move, meaning deworming horses and moving them to a different pasture. This also leads to resistance. Now, there is one exception to all of these rules. Foals should all be treated as if they are high shedders, because their immune system has not yet developed enough to ward off all the parasites. So foals do have a schedule for the most part. None of them should be dewormed before 60 or 70 days of age. Then at 3 months of age, they should get a weight-appropriate dose of Strongid. At 6 months, they should receive a fecal egg count, and deworming can be targeted toward ascarids or strongyles, depending on which type currently affects that foal. At 9 months, they can receive an ivermectin, and at 12 months, they can receive an ivermectin plus praziquantel, so a Zimectrin Gold or an Equimax. These recommendations are based on the 2013 guidelines published by the American Association of Equine Practitioners. As an alternative to the schedule, foals can receive fecal egg counts every 3 months with targeted deworming. Foals are treated as high shedders until they are 2 years of age, meaning they should have fecal egg counts performed every 3 to 4 months. Once they're 2 or 3 years old, if they are a low or moderate shedder, they can then go on a twice-yearly fecal egg count schedule. Now, the last thing I have to mention, because it's on everybody's mind at this point, is how much is it going to cost to change from a rotation deworming program to a fecal egg count-based deworming program. Now, if you assume that you're deworming every 8 weeks, depending on the products you're using, you're probably spending around $50 a year. If you're using Strongid C every day, you're probably spending about $235 a year. And if you switch to a fecal egg count-based deworming program, assuming your horse is a low shedder and only needs a fecal egg count twice a year, as well as 1 ivermectin plus praziquantel yearly, you're going to spend about $66 a year. So it's not very much more to switch from rotation to fecal egg count-based, and you're doing the right thing for horses. And that's it. Thanks so much for listening. I'm Dr. Lisa Kivett with Foundation Equine in Southern Pines, North Carolina, and you can find us at our website, foundationequinevet.com, or on Facebook. Thanks again.